Good morning. Today we're in the company of Dr. Eliana Mioni, specialist in rheumatology, to talk about the contraindications of thermal treatments. When we talk of thermal treatments, we are effectively talking of real therapies. So, Doctor, let's discuss the contraindications of thermal treatments.
The main indications for mud therapy are, without a doubt, the degenerative pathologies of the locomotor apparatus. The majority of our patients suffer from polydystractural or localized arthrosis in a joint.
These are mainly joint indications, but there are also extra-articulation rheumatisms, or rather something that affects the area around the joint. In these cases, are thermal treatments, mud treatments and baths, for example, useful?
Certainly today, spas are attracting many young people and sports people who come not because of an arthritic knee, but because of some muscular or tendinous pathology, sometimes caused by sport, or pathologies such as fibromyalgia that are linked to everyday stress and strain. Therefore, both muscular contractions and tendinous pathologies, and therefore pathologies of the soft tissue around the joints, can all benefit from our therapies.
If this is the case, and these therapies are increasingly well detailed and attract a younger user, becoming part of the well-being sector in general, what contraindications can they have? Who cannot have thermal treatments?
Contra-indications are, above all, for full-body mud therapies. Although they are greatly reduced when the mud is used for partial treatments, obviously causing fewer circulation problems and less tiredness in our patients. However, cardiac failure, kidney failure, hepatic failure, as well as vascular pathologies, both cardiac and cerebral, when serious, greatly limit our therapies.
Today, regarding neoplasms and tumours, we tend to talk more about chronic pathologies, because that's the mark of modern oncology. But can a patient that has suffered from a tumour have thermal treatments for a pathology that can benefit from them?
Many people come to us who've recovered from a tumour. These are patients who can have thermal treatments quite happily. The only thing to bear in mind is the timing. A patient who has recovered from a tumour is often exhausted from the disease itself as well as the cure, and they should be treated with very light therapies.
Therefore, we can say that today tumours no longer constitute a contraindication. That said, the spa doctors, such as Dr. Mioni, will take measures to identify which patients can and cannot have thermal treatments. A final question, Doctor. During the treatment cycle, is it necessary to keep to a particular diet and nutritional regime?
Certainly. In particular, all mineral salts found in fruit and vegetables should be supplemented, and the body should be treated well. Often our patients exaggerate with things that, used within reason, can help to give that feeling of well-being that is so useful in beating chronic illness.
Thank you, Dr. Mioni, for your precious advice. We hope to see you again soon.
Thank you.